Do you have lip filler migration? Here's a rule to go by when it comes to lip enhancements. You should not be able to look at someone and tell they had their lips done. If you can tell, it means they've pushed their anatomy beyond its boundaries. And when you push your anatomy beyond its boundaries, it shows in 3 distinctive signs, and I'm going to tell you what those signs are to help you determine if your lip filler has migrated or if it's unnatural looking. I'll show you the differences between natural looking versus unnatural looking lip tissue. And I'll take you through the step-by-step process on what it's like to get your lips dissolved and answer some of the most common questions. And you'll see what I did to correct migration and retreat this patient's lips to give her the natural results she desired. And we're starting right now. What is lip filler migration? It's basically over-injected lips. It's when lip filler spreads or migrates into areas beyond the vermilion border. Here are 3 signs that you have overfilled lips or migration. Sign number 1, an upper or lower lip that looks rolled, which can make the borders of the lips lack definition, and this can be present to both the upper and lower lip, but it's more commonly seen on the lower lip. Sign number 2, puffiness above your upper lip near the vermilion border, which some describe as looking like a shelf or looking ducky. It will sometimes cast a shadow to this area too, which some say can make you look like you have a subtle mustache. Sign number 3 is the most obvious sign that you have overfilled lips, which is the look of induration or hardness. Induration means a localized hardening of the soft tissues where the area becomes firm. And this is why the lips are often described as rubbery looking or sausage-like, because sausages look very firm, like you could stick a needle in it and it'll pop. You don't have to have all 3 of these signs. As long as you have the induration or hardness, you have over-injected lips. And having any one of these 3 signs are the result of too much filler being present in your lips. And if you're assessing your lips at home, keep in mind when you talk or smile, it stretches the skin, so you can't appreciate the induration or hardness as much. I get comments on my videos about how unnatural, ridiculous, and botched my lips look. Check this out. This is the day I was getting chin filler done.
I'm not going to try to match your full lips because your lips are augmented.
No, these are real.
Oh, those are your...
I have never injected my lips before.
Oh, I thought you have.
No, I just do the lip flip.
I'm going to say this again. I have never injected my lips with filler or any other substance. It seems to me that a lot of people forget that some people naturally have larger, fuller lips. It's one thing to speculate that I had my lips done. I'm a cosmetic injector. I work in this field. But for somebody to automatically say these lips are augmented means they can tell. It means they think that I'm exhibiting one of the 3 signs. I think because we've been living in a world for so many years where people have been walking around with these over-injected lips, and it's become so normalized that people don't know how to tell the difference between natural looking lip tissue versus unnatural looking lip tissue. And that's probably why there are a lot of people walking around with migration. But I'm going to show you the difference. These are 100% natural lips that have never been injected, and these are lips that have been over-injected and have migration. She is all of the 3 signs. Puffiness above the upper lip, and while they both have a full lower lip, can you see that this lower lip exhibits induration and hardness, while the lips on the right are also large, but the tissue doesn't look as firm. And you can also see that her lower lip looks rolled. Now, the patient has naturally full lips. Watch as I press on them. They give in, almost like I'm pressing on a pillow. You can see that they're soft. Now watch as I press on lips that have been over-injected. It doesn't give in as much. It's not pillowy. It's firm, more rubbery and indurated. And this is what gives it that sausage-looking appearance. Now watch in comparison. Soft and pillowy versus hard and rubbery. And this is what happens, guys, when you have too much filler in your lips. Will over-injected lips go away on their own if I wait? Probably yes, but this could take weeks to several months to several years, depending on how much volume you have in your lips and how fast your body metabolizes the filler. With that being said, if you think your lips don't look natural or you have migration, it's probably better that you get it dissolved, because no one's going to be able to tell you exactly how long it'll take for your results to go away. And do you really want to walk around for months, possibly even years, with lips that look botched?
I did get compliments from my family, my cousins. They were like, you don't need more lip filler, because I did mention that I wanted additional lip filler. And one of my family members was like, no, you don't need any more. Your bottom lip looks already a little bit too overfilled. So then I did start noticing that she was probably right. I was looking at old photos of myself, and I did notice that my lips and my face aesthetics, like my structure, looked a little bit more natural.
So she scheduled a virtual consult to determine if she had migration, and during the consult we concluded that her lips did indeed look over-injected.
Yeah, I think I had lip filler blindness.
So how do you dissolve lip filler? Filler made of hyaluronic acid is the only type of filler that should be injected into the lips at this point in time. Hyaluronidase is an enzyme that we use to dissolve filler, and it works by breaking down the hyaluronic acid. With each treatment of dissolving, the enzyme hydrolyzes the hyaluronic acid into smaller chains and it becomes more liquefied. How many lip dissolving sessions will I need? Dissolving filler is not an exact science in that we try to give you as much of the enzyme as we think you'll need to be effective, but how many sessions usually boils down to how much volume you have in your lips and what filler brand was injected. Certain filler brands are more resistant to being dissolved by this enzyme. Because it's not an exact science, there's a chance you might need more than one session of dissolving. You might need 3 to 5 sessions of dissolving, especially if you're trying to get back to your original lip size. A lot of times providers will want and they will try to take you back to your original lip size before they retreat you with lip filler. So I'll ask for patients to bring in before and after photos from the practices that treated them, but a lot of times they don't have access to this. So I'll ask for old photographs of themselves before lip filler so we can assess what their baseline lip size was. This patient was treated over the course of 1 year for a total of 3 lip filler sessions. So we don't know exactly how much filler she has in her lips at the moment. So we're gonna guesstimate how much enzyme we feel she'll need to do the job, but we're not gonna be surprised if she has to do more dissolving. So we numb her up with topical anesthetic to make the injections less painful, and we inject the lips with the enzyme hyaluronidase to dissolve the filler. The enzyme is a liquid, and the liquid is going to take up space in your lips, therefore it's going to add more volume. So your lips are going to be more swollen and larger immediately after dissolving, and they're going to look more full than they were before, but this will go down in around 2 to 3 days. After around 3 days up to about a week, we can usually tell if you need another session of dissolving. Bruising and swelling after treatment are common, and the bruising can last around 1 week. She bruised like this the very first time. The second and third sessions of dissolving did not cause as much bruising as the first time. So here she is after her first session of dissolving. Here she is after the second session of dissolving. And here she is after the third session of dissolving. And we're always comparing her lips to her baseline pre-filler photos. And you can see she's a lot closer to her baseline lip size now. And if we look at her from the profile view, all 3 signs have resolved. The puffiness is gone, the lower lip no longer looks rolled, and the lower lip looks a lot less indurated or hard. But because her lower lip still feels a little firm, there's a chance she has a bit of scar tissue present. So because of this, when we do her lip filler, I'm going to concentrate on treating her upper lip, which you'll see here in a sec. But first I have to show you her results from the lip flip, which is done without any filler. A Botox lip flip is done using neuromodulators like Dysport or Botox, and it will enhance your upper lip, and you can see how it gave her a nice subtle enhancement to her Cupid's bow. And these are her thoughts about the lip flip.
I love it. I can't believe I wasn't told about this sooner before I got my lip filler, so that I could at least compare the differences between having your lips filled versus just having a little lift with a lip flip, because it looks much more like natural. Coming from having lip fillers 3 times to now to dissolving my lips, I love it. I love the way it looks. I love the way it fits my face. I don't feel like I have like fake lips or botched lips or the duck lip look. So.
Then we retreated her with lip filler for more of an enhancement, concentrating on her upper lip. And if you look at her from the side, her lips are actually more pouty. They stick out more. And a Botox lip flip is not a substitute for lip filler, because lip filler is the only thing that can make the size of your lips larger by adding volume to the lips. Therefore, lip filler can give you more of an overall enhancement, and you can treat both lips, the upper and the lower lip.
I love them. They look super natural and they look more symmetrical now, which I love it.
Now, there have been people who believe that filler dissolve or hyaluronidase destroyed their face, not from dissolving the filler, but from depleting the fat, collagen, or the natural hyaluronic acid in their skin tissue. Dr. Gavin Chan tackled this subject, in which he collaborated with 5 physicians, one of which did believe that hyaluronidase could have everlasting effects. And I fully agree with Dr. Tim Pierce, who responded to this video with compelling key points of why hyaluronidase would not permanently destroy skin tissue. Filler dissolve or hyaluronidase is found in most tissues of the body. It's a naturally occurring enzyme. Sperm cells rely on this enzyme to break down the hyaluronic acid in the egg cell in order for fertilization to occur. Enzymes are also very specific in what they target. In this instance, it can target the hyaluronic acid in the filler, or the natural hyaluronic acid in your skin. But if it does dissolve your natural hyaluronic acid, you should build it back up in around 2 to 3 days. At this point in time, I don't believe that we have evidence to support that dissolving filler will dissolve somebody's natural hyaluronic acid for long periods of time. Therefore, it will not destroy your face. And if you're really worried about this, watch Dr. Tim's video. He really goes in depth on this topic. If you have a friend or family member and you just don't have the heart to tell them you think they have migration, consider sending them this video. If you want to prevent this from happening so that you'll hopefully never have to have your lips dissolved, you need to watch this video.